Hello, Nate Tice here again with the Therapy Bar, and today we're going to be talking about a few different muscles that are particularly difficult to isolate with traditional exercises in the gym. We're going to be talking about the medialis of the quadriceps, the lateralis, and the transverse abdominal. And again, when it comes to trying to isolate these motions in particular fashion in the gym with traditional pieces of exercise equipment, I found it to be almost a nightmare to isolate these things correctly. So we're going to dabble in the specifics behind how you should do these motions with the therapy bar and exactly what they should feel like, which is probably more important than anything else. So one of the problems that I've found when trying to isolate the lateralis and the medialis is that we actually need oppositional pull on the joint to truly isolate the different divisions and sections of these muscles. So we're going to start with our lateralis, and we're going to be driving the femur into external rotation, which again is going to force the internal rotators of our hip to counter the force of these bands, in particular our lateral quadricep, when we're doing those motions in this specific way. So as you can see, the optimal force angles needed to engage this muscle have to be coming from both directions. For those of us who are testing this muscle on the table, we know that and we see it every day. But again, mimicking these motions in the gym with traditional pieces of exercise equipment, yeah, we could grab a couple bands, but we've got to find those to tie into something. We've got to have an equal amount of torque, ideally placed on both sides of those bands. It becomes very tedious. The time in which it takes to set up the little apparatus is almost more consuming than the benefit of the exercise itself. As you can see, I'm using these little pieces of a TheraBand, which I actually prefer over the straps. I've used those in the past, and honestly, these work better because you can wrap them around the joint without any impingement. And as we'll go through this motion, we'll show you different ways in which you can utilize these bands most effectively. So you can see as I externally rotate the tibia and plantar flex the foot or point it down and out, we're going to be forcing the femur into internal rotation. As we slowly straighten out and extend the knee, we're going to feel more of the distal aspect of that muscle engaging. As we flex and come back up towards the top, we feel it crawl underneath the TFL and that lateral proximal aspect of the quadricep on the outside here. We can also engage this muscle by simply flexing and extending the knee. So as you can see, these bands pulling on opposing sides of the hip here create the optimal forces needed to engage the lateralis. So if we switch our bands and move more towards the upper quad here, we're going to find that if we drive the femur into internal rotation, we're going to use the external rotators as well as that vastus medialis to oppose that internal rotation. So now we just do the opposite motion. We're going to internally rotate and plantar flex that foot downward as we externally rotate the femur, feeling for the different divisions of that muscle. And again, I like the bands because we can flex and extend the knee without the potential of any impingement created at the motion. And again, the best way to engage a muscle is through its full range of motion. So if we're not taking these muscles to their end range, then who knows what type of success we're going to have with that muscle contracting through its short range. So as you can see, there's our medialis and lateralis. Pretty straightforward. yet extraordinarily isolated. Moving on now to our transverse abdominis muscle. This muscle is huge in a number of different ways and encompasses a huge amount of space between our thorax and pelvis, along with interdigitating with almost every single muscle, or tying into and connecting to almost every other muscle in the trunk and spine. If this muscle is not working, we could be running into quite a few problems in who knows how many different areas of the body. So it's important when trying to isolate any specific muscle that the origin and insertions are fixed and that we're isolating it in the best possible manner we can. And when it comes to this lower TVA, we want to make sure that the pelvis has a very solid foundation for this muscle to anchor to. So that's why we're sitting on the table here. It keeps the pelvis fixed, and from moving, on top of that, we're going to put about 90% of our weight on this right leg. So we're going to firmly plant that foot into the floor, flex that quad, squeeze the cheek, and give this muscle a solid foundation to anchor to. As we do that, we're going to pull this bar right up underneath our xiphoid process, firmly keeping it against the thorax, the ribs here, and we're going to flex and rotate, flex and rotate, flex and rotate, flex and rotate, flex and rotate. Now some people are going to be able to move further with that. Some people are going to be more limited. I'm not so concerned about the range of motion as I am the sensation in which people are feeling when trying to perform that motion. And that is where we start running into trouble. If we do not have a bar that's pulling on us in oppositional forces at all times, then the torque created throughout different segments of the body is endless. If we're trying to do this motion standing with a traditional wood chopping type of motion, now the force is coming from the right, I'm standing more on the right leg, so that torque gets taken all the way up and through the hip here, and we end up working more psoas and quadratus lumborum, some multifidus, especially if we're in extended position. If we flex a little bit, now we're getting a little bit more of that external oblique and internal oblique on the left side, depending on how much we're side bent, this, that, and the other. If the pelvis isn't fixed, again, the psoas and iliacus are going to really be screaming, trying to stabilize the femur, pelvis, and spine. So if we're not in a seated position, number one, we're going to have trouble isolating this muscle. And if we are only getting pulled from one side, then you're never going to feel it the way that you should. I have tried and tried and tried to isolate this muscle in traditional gym exercises, and it's next to impossible because I've not been able to find a piece of equipment that pulls on my spine in a very symmetrical oppositional force. And that's what's important. I know some of you are probably going through this motion at home saying, oh, when I flex and rotate, I feel left side abdominal, right pyramidalis, left external oblique, maybe a little bit of internal oblique and some erectors on the right here. I would too if I wasn't using this therapy bar. So again, the necessity of having this oppositional pull is paramount. It's huge. So with that being said, we're going to move along to the upper part of the TVA. Now again, when it comes to the pelvis and stabilizing that lumbopelvic girdle and anchoring things from the bottom up, then we want to tense that lower TVA first while squeezing the quad, squeeze the cheek, make sure that leg's got a solid foundation against the floor, and our hips and pelvis are anchored against the table here. As we hold the bar in the same place, right up against the thorax, we're going to flex and squeeze, flex and rotate, flex and rotate, flex and rotate, flex and rotate. Now again, if I was to do that motion without this oppositional pull of the bungees, then I'd be feeling a lot of abdominal. And to a certain extent, I will be feeling some abdominal. But we want that sensation from that linea alba where the abdominis connects to run all the way out to the costocartilage of our ribs. And literally, when we start getting really in tune to the sensation of this muscle, this upper part ties in and connects to the fifth and sixth rib. the 7th and 8th rib tying a little bit lower, a little bit lower, a little bit lower, a little bit lower. So we can literally start to feel that 12th rib tie all the way into the top of that belly button. Hopefully that gives you guys a couple ideas as to how this thing really works and how it can be most effectively utilized in your practice and with patients. And I suppose that'll do it. Thanks for watching.